Welcome to the Connecting Kids to Coverage National Campaign webinar. Our topic today is promoting Medicaid and CHIP during Marketplace Open Enrollment. I'm Gabby Duran. I work closely with the Connecting Kids to Coverage team to support the enrollment of more children and parents in free or low-cost healthcare coverage. Open enrollment for the health insurance marketplace is an important time of the year when intention to health coverage is high. The 2017 Marketplace Open Enrollment season runs from November 1st, 2016 to January 31st, 2017. And while Medicaid and Children's Health Insurance Program, CHIP, enrollment is open year-round, families may learn about their eligibility in these programs at this time. Having information about Medicaid and CHIP at the ready while conducting marketplace outreach can connect eligible but unenrolled children who need health care coverage to vital services. Our webinar today will provide you with tips for conducting outreach during the Marketplace Open Enrollment and support to develop messaging and activities that will resonate with families during this important time of year to expand the outreach of your enrollment work. In just a moment, Jessica Boscheman from the Centers of Medicare and Medicaid Services will walk us through the agenda. With that being said, I'm going to pass it over to Jessica to begin. Jessica?
Thank you, Gabby, and thank you to everyone for joining us here today. Our speakers today will cover various strategies and tips for your organization to engage in when conducting outreach during Marketplace Open Enrollment. Our speakers will also discuss how to develop messages and activities that will resonate with families and help expand the reach of your enrollment work. We will first hear from Lisa Wilson, who's with CMS, and who will discuss outreach and enrollment strategies to implement during Marketplace Open Enrollment. Next, the Director of Training and Consumer Education from Young Invincibles will walk us through the Healthy Young America campaign and the best practices for engaging millennials about health insurance. We will then hear from the Director of Policy and Strategic Initiatives at Enroll America, who will share insight on how to increase access to comprehensive health coverage. Then a policy analyst from Community Catalyst will share best practices when it comes to building strong networks for healthcare enrollment in the marketplace. We will also hear from the Executive Director from Consumers for Affordable Health Care Foundation, who will provide tips on how to leverage Marketplace Open Enrollment in order to highlight Medicaid and CHIP. And finally, we will learn more about the Connecting Kids to Coverage national campaign resources that can help strengthen your outreach efforts. We will also take your questions at the end of the webinar, so please feel free to use your chat box throughout the webinar. Gabby?
Thank you, Jessica. Before we begin, let's answer a poll question. In your past Marketplace outreach and enrollment work, have you promoted Medicaid and CHIP? Please submit your vote by clicking on an answer that is on your screen. Great. Thank you all for your responses. We're about to close up the poll. And it looks like in the results this year that the majority of you, almost 82%, answered yes, that you have promoted Medicaid and CHIP in your Marketplace outreach and enrollment work, which is great to hear. So today we really are looking forward to getting your feedback too. So if there's anything you'd like to add, please feel free to add it into your comment or question box too during the webinar. We'd love to hear your experiences and strategies in that section, the meeting control panel. Great. So our first speaker today is Lisa Wilson. She is a senior advisor from the Center of Consumer Information and Insurance Oversight at the Centers for Medicare and Medicaid Services. She's going to talk today about discussing overall strategies for outreach and enrollment during Marketplace Open Enrollment. Lisa?
Thank you so much. And let me just say thank you to everybody for having me here today. It's really exciting to talk to a group of people who work so much on making sure that all people in our country have access to health coverage and health coverage options. Hopefully I can give you a little bit of information about some of the options under the marketplace and then connect it back to some of the work in the Medicaid and CHIP world. So let me just, of course, again, begin by saying thank you for all the work that you do out in the field. Without all the work that you're doing, there's no way that folks in the ivory tower like me could ever, be able to reach so many people in the country. So thank you for everything that you do. We're going to start off. I'm going to just run through a few things. Everybody out there, you've been an important part of this work. Today about 20 million fewer people are uninsured. The Affordable Care Act has driven the uninsurance rate below 10% for the first time ever, which is amazing. So give yourself a pat on the back for your part of that. It was just 6 years ago that millions of Americans were locked out of our healthcare system because they couldn't afford insurance or because they had pre-existing conditions. Women were charged more than men. Healthcare costs are rising. So, we know that there was a lot of need for the Affordable Care Act. Next slide, please. Again, you can look at these numbers. Amazing results on pre-existing conditions. So many people had lifetime limits and weren't getting the preventive services that they needed. And now, thanks to the Affordable Care Act, that's people are able to access those things today. Next slide, please. So the Marketplace uses an eligibility determination to help people get access to a health plan through a private health insurance company on the exchange or the Marketplace. Kind of different people talk about it differently. All of our materials call it the health insurance Marketplace. So just making sure everybody's on the same page and giving you kind of the basic 411. We sell, our insurers offer qualified health plans through the Marketplace. They allow people to access premium tax credits that lower what somebody pays for their monthly health premium. It also, depending on their income, may qualify them for cost-sharing reductions to lower what people pay on out-of-pocket costs. And of course, everything is linked in that we're trying to make it as streamlined as possible through Medicaid and CHIP. Next slide, please. For folks who are interested in helping people obtain coverage through the Marketplace, we have 4 ways people can apply. Obviously, the first step is to, submit your application and get your eligibility process determined. All of that can happen real time, whether you're over the phone, online, or in-person help and we know that different people have different needs. So some people like to be online, some people still prefer over the phone, and then there's a group of people that really like that face-to-face interaction. So not only do we have groups out there, and maybe even some of you are part of our local coalitions that are assisters working with people in person to help them apply for Marketplace coverage. We also have agents and brokers that are working on insuring people through health insurance companies too. So a lot of ways people can qualify for the Marketplace coverage. The big thing, and this is one important difference, so if you spend a lot of time on Medicaid and CHIP, one important piece of the pie that you have to remember is that you go through the eligibility determination, and then you have to enroll in a plan. And so the enroll in the plan is sort of a 2-part process in the Marketplace. So first you go through and you pick a plan, so you select a plan, and then you have to effectuate coverage is what we call it in the health policy wonk world. But all that really means is that you make your first month's premiums payment. So, most of us who have insurance through our employer know the drill about paying our health insurance premiums every single month. In the case of the Marketplace, in order to actually get enrolled in the plan, you have to pay that first month's premium payment. So I just wanted to call that out because that is one important difference between the world of Medicaid and CHIP and the world of the Marketplace. And I know that there, various states have a lot of different cool programs in the Medicaid and CHIP world, so some of this may or may not apply. But I just wanted to make sure that you knew that in the Marketplace, we do have that important step where people have to make their first month's premium payment, and we're really emphasizing that this year to make sure people get their the coverage. Next slide, please. So we've already talked about important date next week, November 1st, open enrollment starts. That's the first day that you can enroll or re-enroll or change to your 2017 plan. The coverage would start as soon as January 1st. You have to help people enroll by December 15th to get their coverage started on January 1st. And next slide, please. Kind of going through one more slide on dates and deadlines. January 1st, 2017 is when coverage would start for any of those folks who came in by December 15th. And January 31st, 2017 is the last day folks can enroll or change their 2017 health plan. After that day, people have to change plans only if they qualify for a special enrollment period. That means you, for lack of not to go through every single one, but got married, divorced, or, had a baby. So life-changing events. Next slide, please. I think I already alluded to the importance of in-person assistance, but let me just say it again, and I don't think that I have to tell this crowd how important it is to have that personal interaction. Help is available in the Marketplace. We do have a call center that people can interact with a live person. We also have localhelp.healthcare.gov where folks can go and find a real person that they can sit across from in their area. So it's an exciting tool. It boasts on one tab lists the folks who are assisters, so tends to be a lot of community-based organizations and other folks like that. and then also agents and brokers who are available. We have awesome language assistance through our call center, and even have help for folks who might be looking for an application and looking for the job aid in many different languages, 33 different languages. So I'm going to move to the next slide, and I'm going to just quickly talk about, there's been a ton of marketplace news, and we've obviously been able to learn a lot of lessons from some of the things that we've gone through here at the marketplace. I've been here since day one, and we have learned a lot. So number one is affordability reigns supreme. People want their health care to, be this high-quality health care, but they're going to come back and shop. People are really engaged, and they want to know what's going on. They also want to know if their doctor and hospital and drug coverage is all there. We have new tools that have been further incorporated into our process this year, so people can do that more seamlessly. We're seeing definitely the marketplace mature. It's seeing some innovation happening in the marketplace as insurers look to, what's my network look like? How can I better coordinate care across, different providers? What are the right benefit designs? And how can I really retain my customers on a monthly basis? So what we're seeing is that not, one size doesn't fit all. This doesn't surprise people in the Medicaid and CHIP space at all, because that's what you already know, and that's why the Medicaid and CHIP programs have become so successful, because you're able to tailor it to populations in your state. So a lot of the same lessons learned. 2 seconds more, I want to just spend letting people know, we're also spending a lot of time this year on marketing towards young adults. We've announced some really cool stuff around the gig economy or innovation economy. So a press release went out yesterday talking about some of the cool partnerships that we have with, companies across that sector. We're also doing some really cool stuff with, a world that I didn't know before this. Many of you may know it. It's called Twitch. It's like an online gaming platform. We're going to be spending a lot of our ad buy there trying to target some young adults. So you'll see some really cool and innovative stuff going on in the marketplace this year, whether it's, from the marketing side, like I've just mentioned, or, actually the health insurer side. So a lot of cool stuff going on. November 1st, everything starts, and don't forget the enrollment dates are November 1st through January 31st. Final slide, how do we connect this back to the world of Medicaid and CHIP? So remember, of course, folks can apply anytime, with the Medicaid and CHIP world. And, you want to look for some themes that, are really easy to work your messaging in through. And so, that's like back to school or cold and flu season, and, really emphasizing all the quality of care and the huge range of benefits that are covered, like dental and immunizations. And, again, retention is just as important in the Medicaid and CHIP world as it is in the marketplace. So with that, I'm going to pause and see if anybody has questions, and thanks for letting me answer some questions midway through the webinar.
Well, thank you, Lisa, for all that great information. And at this time, there are no direct questions, but, we will follow up if there's any questions towards the end of our Q&A session. Thank you, though, for all that really valuable information, letting us know about some of the cool new spaces that you all are getting involved in to reach more people about the marketplace. So thank you.
I hope everybody was Googling Twitch.
Thanks for that. And before we continue on to our next speaker, we're going to ask another poll question. So what are the key times of year for your outreach and enrollment efforts? And you can select all that apply for this question here. Great. It looks like, a lot of you are actually, 81% are conducting outreach and enrollment efforts all year round, followed closely by Marketplace and then back to school. So we're glad that everyone's taking advantage of these really prime opportunities to reach families and children about healthcare coverage. Great. So our next speaker now is Erin Hemlin, and Erin is the Director of Training and Consumer Education at Young Invincibles. Erin?
Great. Thank you so much. Thank you for having Young Invincibles on today. I'm really excited to talk a little bit about my work, and thank you for all who took some time out of your day to join the webinar. Again, my name is Erin Hemlin. I'm the Director of Training and Consumer Education at Young Invincibles, and I've led our healthcare outreach work for the last few years. Next slide, please. For those of you who may not be familiar with our organization, we are a national nonprofit organization focused on economic advancement for millennials. And by millennials, we generally are talking about young adults ages 18 to 34. We work primarily on three main issues: access to healthcare, access to higher education, as well as some financial security and workforce issues. Through our work on healthcare, we actually got started back in 2009 as the debate over healthcare reform was happening in Congress. Our founders were students at the time who felt that the young adult voice wasn't really being represented in the conversation over healthcare reform. So they started a movement to gather stories, to hear what young people cared about in healthcare reform and kind of bring that voice to the table. Through that work, we ended up culminating around the provision of being able to stay on your parents' health insurance until the age of 26, which was ultimately successful and still to this day one of the most popular parts of the law. So after the ACA passed and was signed into law, we started the organization Young Invincibles to kind of see through implementation of the ACA. And through that, we started and have led a campaign called Healthy Young America, which I'll go into a few details next. Next slide, please. Okay, so quick agenda. Again, we started this campaign, Healthy Young America, really with the goal of reaching young adults to provide just a basic consumer education of what the Affordable Care Act is, how it impacts young people specifically, and then provide partners with the outreach, the best practices and tools to reach young people in their communities and help them get signed up for coverage. So I'll run a little bit of a background of that and then talk a little bit about the key messaging and outreach best practices we've identified through that work over the last couple of years and a few new initiatives that we're working on for this open enrollment period. Next slide, please. Okay. To start off, I'd just like to kind of give a quick overview of how far we've come. As you can see through this graph, young people were uninsured at higher rates than any other age population or age group prior to the ACA. And we have seen just dramatic declines in the uninsured rate of young people. So prior to the ACA, young adults 18 to 34 were uninsured as high as 28%. That dropped down to 22% in 2014 and is now as low as 15% this year, according to new census data that just came out this fall, which is an incredible drop. We've seen that drop 7.4 percentage points, which is twice as much as older Americans, 35 and older. So we've really come a far way, even though there's still work to be done, and we're really excited to kind of make that number even lower this open enrollment period. Next slide, please. Okay. So to give a quick overview of what we did with our campaign, so we basically used three methods to reach young people all across the country. The biggest one was a partner training series. So we've led a train-the-trainer type series, working with a variety of different partners all across the country. A lot of in-person assisters, navigators, healthcare outreach workers, all kinds of folks who are working directly on ACA implementation, as well as organizations and partners who work with young adults or have networks of young adults but didn't necessarily have that healthcare piece, such as college advisors and faculty, YMCAs, Boys and Girls Clubs, et cetera. And the idea was to kind of give them information, kind of an ACA policy 101 on how the ACA impacts young people and some of the biggest benefits and motivators for young people to sign up, as well as those outreach best practices I'll talk about in a minute on how to kind of get that message out there within their community and help motivate young people to enroll. In addition to that work with partners, we also did a lot of direct consumer education through education enrollment events that we held on the ground in about 20 states over the past 4 or 5 years, as well as online. We ran a pretty sophisticated digital outreach campaign through social media and our email list to reach young people as they are interacting through social media and online. Part of that, we started a Millennial Families Facebook group, which has actually picked up a lot of interest with young parents, where we can share resources and information with young parents all across the country that we've met throughout our work, and they can kind of interact with each other, which has been a really fun way to kind of connect a lot of millennial parents together in one place. Next slide, please. Okay. And through that work, so we've talked to thousands of young people on the ground and online, and we've developed a set of kind of some lessons learned and best practices that have evolved over the past 3 open enrollment periods. Next slide, please. Okay, so to start off, I always like to kind of debunk this, this myth that young people don't actually value or don't want health insurance. We've seen in our work time and time again that this just simply isn't true. Prior to the ACA going into effect, or back before implementation fully took effect in 2012, we ran a poll of uninsured young adults nationwide, and through that poll, only 5% reported that they chose not to have health insurance. Everyone else across the board basically said that they didn't have an affordable option or just didn't have access at all. So we've seen that through our conversations with folks on the ground, the same thing time and time again. Really, young people want and value health insurance for themselves and their family. It's just about affordability and having access to health insurance. And we know the ACA is an extremely complex and complicated law, and it's hard to kind of comprehend all of that information, you know, when you have a million other things going on. So we found that there really was a huge need just for an education and awareness campaign, which is why we set out to do what we did. Next slide, please. Okay. So a few best practices I wanted to highlight here when working with young adults and especially working with young parents. It's really important to build strategic partnerships and build strong relationships with validators within the communities you're trying to work in. And on the next slide, I'll go through a few of those partners that we've identified in good places to do outreach. But I can't stress it enough, it's really important to try to find people where they are, go to where they are, especially with young parents. They're not looking to add more things to their calendar. You need to kind of go to where they're already working, where they're already socializing, where their kids are going to school, et cetera, in order to kind of get messages out there rather than expecting them to come to us. Digital engagement, again, I've mentioned, has been a really great way to communicate. You know, the vast majority of young adults are on social media and have primary access to the internet through their smartphones. I mean, it's a really great way to kind of get simple messages out there. We recently started a new partnership with a mobile app called Fresh EBT, which is this really great and innovative feature where you can download a mobile app for folks who are eligible for SNAP benefits and be able to see their benefits right then and there rather than having to call to find out their balance. And they've agreed to send push notifications out throughout open enrollment to people who have downloaded that app, which we're really excited about in order to get those messages out there about deadlines and things as they're coming up. And finally, I will talk a little bit more about messaging in a second too, but really tailoring your message to the whole family. We've seen a lot, especially misconceptions, when young adults have been told or young parents have been told that they are not eligible for health insurance. They just automatically assume that their children aren't either. And in many cases, their children will be eligible for traditional Medicaid or CHIP, even if their parents are in a coverage gap in a state that hasn't expanded, or maybe now they're eligible for Marketplace insurance, but we're told in the past they weren't. So really making sure that the messaging is tailored for mixed status households and mixed eligibility households as you're working with young parents. Next slide, please. Okay. Again, so I just wanted to highlight a few of the key partners that we've really strived to work with when working with young adults and young parents. Community colleges is really a great place to do outreach and try to build relationships. Prior to the ACA, a lot of community colleges had uninsured rates as high as 80%, partly because the majority of their students tend to be what's called a non-traditional student, students who are older, above the age of 26, who are no longer on their parents' insurance, who maybe are going to school and working part-time and don't have an employer option. So it's just a really great place to do outreach and find some of these young adults who are likely eligible for Marketplace insurance. And when working with young parents specifically, we've had some success working with clinics and trying to talk to young parents who are taking their children in for checkups or immunizations at the beginning of the school year to talk to the parent about their insurance needs. And kind of getting them all in one place has been a really successful tactic for our in-person assisters. In addition to that, working with elementary schools, PTA programs, even the YMCAs and kind of recreational league sports for children, Pee Wee football, Pee Wee baseball, all kinds of programs like that, and trying to reach a group of young parents in one place to get information out there to set up appointments remind people about open enrollment and remind people about financial assistance has been really, really a great place to do work. Next slide, please. Okay. So again, to identify some of those key messages when we're working with young people, we've really found that there are kind of 3 phases of messaging to young adults specifically. And I kind of think of them in kind of the first phase being really highlighting the benefits of having a health insurance plan, walking through what preventive care looks like. We found in our work that just saying the term free preventive care is available when you have health insurance wasn't really resonating with the young folks we were working with. However, once we kind of broke down what is included under preventive care, that really clicked, and they could see value in that. It was just the term was just not familiar, not resonating as a health insurance benefit. But especially for young women, access to contraception without a copay is a huge motivator. For young parents, well child visits and prenatal care and pediatric care for their children are great benefits that are included in every plan through the essential health benefits, and really important to highlight. The second phase is definitely kind of the financial aspect. I think the financial security and kind of peace of mind of knowing that having health insurance, you're protected against a huge medical debt if you are to get sick or get in an accident. That can be a really, really positive message too. And then, of course, finally, the fact that there is financial assistance available, and that for young adults disproportionately benefit from the subsidies. If you are a young person just coming out of school, working entry-level salary, or maybe working part-time while you're finishing school and have a lower income, you're going to benefit the most from those subsidies. And really driving that point home is really critical to motivating young adults to enroll. Next slide, please. And so just to illustrate that a little bit further, when we're talking about affordability, it is really important to make it concrete and give localized examples. We found that again, the vague financial help or financial assistance is available. It tends to not resonate with folks, and a lot of people seem to think that that's going to be for somebody else and not for them. However, if you kind of break it down into a really specific example of saying, for example, we spoke with a Virginia mother, and she and her child were able to get covered for $17 a month. That's affordable, and that's intriguing, and that will motivate people to see what their options are. So definitely, kind of keeping it simple and keeping it very clear of what that affordability piece means, specifically for a young parent and how much they're going to benefit from the subsidies is really, really important. Next slide, please. All right, so a few more slides I have on just kind of what's coming up and some new initiatives for Open Enrollment 4. Next slide. So Lisa spoke about this a little bit, but I'm really excited about some of the new initiatives coming out of the administration on really, particularly on reaching young adults. Twitch, like as she mentioned, the streaming platform will be running ads and click-throughs that will take you to healthcare.gov to sign up. One of the, I think, most critical updates is the healthcare.gov mobile 2.0, which basically means you can complete the enrollment process through a smartphone or a tablet, which previously you couldn't do in open enrollments 1 through 3. And again, like 1 in 5 young adults primarily or solely access the internet through a smartphone. So mobile access is extremely important for this population. I think this is going to be a really, really big benefit. If you haven't heard of this also, the IRS is also doing outreach this year to consumers who have paid the penalty in the past. And I think that's also really important, especially for young adults and young parents who probably aren't aware that they're eligible for a lot of subsidies and can probably get an affordable plan and not pay that penalty, and then also have that health insurance and that financial protection of being covered. And then finally, healthy adulting. So this is a brand new campaign that we started about a year ago to really kind of bridge that gap of understanding how your health insurance works. It's particularly for young adults. As more and more people gain health insurance, we really want to make sure that that results in better health outcomes and that young people are seeking out preventive care and actually utilizing their health insurance. So we started this campaign and then have since kind of broadened it and partnered with HHS and Enroll America and Out to Enroll and a few other partners to kind of lead this like umbrella campaign called Healthy Adulting to reach out to young folks throughout the year. Next slide, please. So here are a few of the things that we're doing under that Healthy Adulting umbrella. First, we released a toolkit earlier, or about a month ago, called the Healthy Adulting Toolkit. And it's really consumer-facing, but we're hoping that as a kind of package, it works as a great resource and an outreach tool for folks doing outreach to young people on the ground. It, again, has a kind of a fact sheet on the Affordable Care Act, just the basics, particularly as it impacts young people, health insurance basics, and kind of understanding how your cost sharing works. I think that we see a lot that people can kind of grasp the concept of a premium, but then after that, understanding your deductible, your co-pays, your co-insurance, and how they all interact with each other is very confusing, and a lot of people have a really limited understanding of what all of that means and how you can kind of compare different plans with different numbers when you're shopping. So that fact sheet is hopefully helpful in kind of breaking down some of those complex terms, as well as an explainer of how the tax credit works and explaining how the penalty works, and then, of course, emphasizing preventive care. So we have that up on our website now, and we're hoping to develop more materials that we will frequently add to it. We get a lot of questions from young people about dental insurance, for example, so we're creating a one-page fact sheet on how dental insurance works, as well as a one-page fact sheet on a well-child visit and why it's important for young parents to take their children for an annual exam. In addition to the toolkit and online resources, we're hosting on-the-ground workshops that we will be holding in conjunction with enrollment events, so to provide some of that education background to folks as they're coming in to get enrolled. And then, of course, pushing out a lot of digital content and working, hopefully, with a lot of really cool and exciting digital influencers this year to really maximize the message. Next slide, please. All right, and finally, we will be running our fourth National Youth Enrollment Day on December 10th, 2016. This is a national day of action that we've led along with Enroll America and HHS and the White House every year during open enrollment, where we've worked with partners all across the country to really focus on enrollment for young adults on this one day. Every year we've had about 200 events reaching thousands of young people all across the country, and we're doing it again this year. So if you would like to host an event or just be involved in the movement in any way, please reach out to me, and I would love to give you some more details about that. Next slide, please. All right, thank you so much for having me, and I'd be happy to take questions at the end. But that's all for me. I'll turn it back to you guys.
Thank you, Erin, for that great overview of the Healthy Young America, Healthy Adulting, and other Young Invincible initiatives, and providing some really helpful tips for reaching and engaging millennials where they are. That was great. And our next speaker today, we have Sophie Stern. She will be speaking about increasing access to comprehensive health coverage, and Sophie is Director of Policy and Strategic Initiatives at Enroll America. Sophie.
Great. Thank you so much. Good afternoon, everyone. Very excited to be here. Open enrollment is just a week away, so I know you all are doing this work year-round, but things from Enroll America definitely pick up around this time. Next slide. So I just wanted to spend a little bit of time talking about who Enroll America is if you're not familiar with our organization. We are an independent, nonprofit, nonpartisan organization. We're dedicated to working with partners to maximize the number of Americans who enroll in and retain health coverage under the ACA. So we're focused on making sure consumers know about their options through the Marketplace as well as through Medicaid and CHIP. We've been doing this, or I've been doing this work since the inaugural open enrollment period in 2013, and it's been a wild but important and fun ride. We have staff on the ground in North Carolina, Tennessee, Texas, Ohio, Florida, Michigan, and Colorado, and then we have regional directors across the country working with partners at a more local level to get information in the hands of consumers. Next slide. Great. So in terms of what I wanted to cover today, I wanted to talk a little bit about the cycle of enrollment, the remaining uninsured and opportunities for enrollment gains as we think to OE4 and beyond, some outreach messages and tools, and then, of course, the importance of in-person help and tools to connect consumers to local assisters. Next slide. So I have this slide here just to help orient us in terms of the way that Enroll America thinks about enrollment. We really think about it in terms of this cycle of enrollment, that we spend a lot of our time working to identify the uninsured, following up with the uninsured once they've been identified, making sure that they are connected to in-person help in their communities or online resources if that is what they prefer. But once those individuals have really enrolled in coverage, our work isn't over, and I think that many of you on the phone, definitely recognize that our work doesn't stop when somebody has enrolled in coverage, that there is quite a bit of work that we need to do on the back end to make sure that people are appropriately utilizing their coverage, finding that primary care doctor, if they're in Marketplace coverage, making sure that they are paying their premium each month, and that they're actively coming back to the Marketplace to renew. And of course, if it's Medicaid, their re-enrollment dates are a little bit different than Marketplace, but we're just finding that messaging surrounding renewal and making sure that people maintain some type of coverage, whatever coverage they might be eligible for, is absolutely critical. So even though, the next 3 months are going to be quite intensive from an outreach perspective for the Marketplace, this work really does continue year-round. Next slide. So some of you may have seen, but the Urban Institute, in conjunction with the Robert Wood Johnson Foundation, released a report earlier this summer that showed some data on who are the remaining uninsured and really what are the opportunities to reach those individuals and move them to take action to get covered either through Medicaid or the Marketplace. I thought that this report and the data that was presented in this report is particularly relevant to folks on the phone here, just because when you're thinking about who is the most movable of the remaining uninsured, it falls squarely in terms of your target population, in terms of the people that you are working every day to serve and try and connect to coverage. So what the Urban Institute found is that 53% of Marketplace individuals who are eligible for financial help and 67% of individuals who are eligible for Medicaid or CHIP are living in families in which at least one member is already receiving the Earned Income Tax Credit or at least one other public benefit, such as SNAP. 24% of the Marketplace population that is eligible for the greatest amount of financial help, so those cost-sharing reductions, and over 50% of Medicaid and CHIP households have at least one school-age child in the family. And then the next data point here is really just to say that a pretty big chunk of the remaining uninsured who are eligible for a good amount of financial help or Medicaid CHIP are younger adults. So I think this is just to say that the work that you are doing over the next year and future years is more important than ever, and I think that there is the most progress to be seen among the population and individuals that you're trying to interact with and engage during this next open enrollment period. Next slide. So in terms of messaging, we've spent quite a bit of time over the past few years refining our messages to reach consumers. Something that we have learned is that individuals in this space, uninsured, are incredibly price sensitive. And they are, really value the importance of in-person help. We found that people are less likely to react to a message that is, really high level and not personalized. We've tried to get even more specific in terms of our high level messaging. It can be hard to do when you're trying to reach a broad population, but we've tried to get as specific as possible. Something that I would just acknowledge is that when thinking about messaging during open enrollment, and when you're thinking about trying to engage, various different populations depending on their eligibility, it can get, complicated very quickly. So we have found that we just try and keep our messages as simple as possible, understanding that not, each point is necessarily going to resonate with a Marketplace population or a Medicaid population, but our goal is really to use messages that we know that work to get people in the door to meet with that in-person assister to start to explore their options. So the 5 messages that we know that work, are first and foremost that financial help is available to lower monthly costs. This year we're actually releasing new messaging today or tomorrow, and it's going to update this first point to include, more than 4 in 5 adults are eligible for financial help. The second point is, again, the in-person enrollment help is available in your community. 3, coverage helps protect both your health and your wallet. We know that from consumer testing that, people really do value health insurance. They do want it. They do want that financial security. The 4th bullet, new plans and new prices are available. We're also tweaking that for this year just because some of the headlines around issuers pulling out of marketplaces, and we're going to tweak it to just really motivate consumers to shop. There might be a better option, more affordable option out there for you. We know that people who actively shop do save money month to month. HHS has released some good numbers on that. And then 5th, there is a fine for not having coverage. And so I'm sure we can get these updated messages out to you, but they're not changing significantly. But there are some tweaks that we're making for this year. Just unfortunately, we weren't able to have them done in advance of this call. Before we move on to the next slide, I just want to acknowledge that there are some challenges for this year in terms of outreach. We know that there's a lot of conversation around, rising premiums. There are some issuers exiting from certain marketplaces. And then, of course, there's a big election coming up. So those are all things that we need to take into consideration in terms of our messaging to consumers. So in talking about rising premiums, our role is really to serve as an explainer to help consumers understand what is happening. We are pointing out that premium rates are increasing, each year, but it's not as significant as, it was before the Affordable Care Act was passed and new price controls were put into place to slow that growth. And then most importantly, I think that it is that, the financial assistance is pegged to the actual price of plans. And so as prices increase, so does that financial help. So those are kind of our key messages there. And I think one key stat that is important is that even if every premium in the country rose by double digits thanks to financial help, 3 out of 4 Americans could still find a plan for $75 or less. And that's pulled from data that HHS has put out. And I think in terms of, issuers exiting the marketplace, the bottom line is that consumers need to know that they still have options, that there are still multiple plans available to them in their marketplace. On average, even if there is just one issuer, issuers are offering about 10 plans, and the average consumer has about 30 plans to choose from. And so I think that's just an important point for individuals to know. We've also developed a graphic for individuals who are affected by issuers exiting the marketplace. You can go to getcoveredamerica.org to find that resource. So that is just a little bit about our consumer-facing messaging. I think we can go to the next slide. I did want to spend some time talking about our outreach tools. So if you go to our consumer-facing site, getcoveredamerica.org, there are a suite of digital tools that are available to consumers to use for free. The first is our Get Covered America calculator, which helps people estimate the amount of financial help that they might be eligible for each month if they shop through the marketplace. If it turns out that we think that they're eligible for Medicaid, we'll direct them to the appropriate resources. So we've spent a lot of time making sure that we are directing traffic to the right point of entry for people to take action to enroll. The other tool is the Get Covered Plan Explorer, which helps people understand how much they might be spending in total out-of-pocket costs over the course of a year, depending on which marketplace plans they're interested in their area. We take into consideration their health conditions and their overall health status. And, of course, people can look up their providers and drugs as well. And the last tool that I won't spend too much time talking about now is our Get Covered Connector. It's a tool that people can type in their zip code and find in-person help in their community. I'll spend a few minutes talking about that towards the end of the presentation. But some actual tools that we have found incredibly effective to use in terms of outreach are commit cards. It's basically a card that at the top has some information about, open enrollment or new health insurance options for the individual. And at the bottom of that card is just a place for consumers to fill in their information. And so if you're talking to somebody in person, say in a high traffic area, and you're asking them if they're interested in finding out more information about health insurance, you would hand them the top piece of that card that has information about where to go and how to get help, and then you would take the bottom piece, which includes their name, email, phone number, so that you can continue to follow up with them throughout the open enrollment period or throughout the year and get them connected to coverage. Another tactic that we found is helpful is sign-in sheets. If you are a health center, to just have a place where people can sign up to receive more information about health insurance should they be interested. And another tactic is providing staff with call scripts to conduct that follow-up, so you can get a sense of what messages are working, what it is that people are needing help with over the phone, to even refine further your outreach and follow-up and become even more efficient. Next slide. So in OE3, I think you're going to hear from speakers across the board how important partnerships are, but something that I think that in OE3 we had some really unique partnerships, which was incredibly exciting to reach various different populations. We partnered with the DMV. We partnered with utility companies to make sure that people were receiving information with their utility bills surrounding the availability of in-person help. And so I think that when thinking about people that you can work with in your community to get the word out, that it's okay to think outside the box and really think about who are those stakeholders in the community that touch consumers that you're trying to reach the most, and how can you get them involved or understand the value of participating in this effort to reach consumers. Next slide. So again, I think, Lisa talked about this, as did Erin, but I think the value of in-person assistance, we just can't say this enough. We know that people who received in-person help were 60% more likely to successfully enroll in coverage. Over 80% agreed or strongly agreed that they would recommend in-person assistance to a close friend in a survey that we conducted after the third open enrollment period. And something that, is interesting, we're finding that it's not just, older populations that are wanting in-person help. It's actually even young adults who we all think are tech savvy, but, and who very well may be, but they are also wanting that in-person assistance. So it's just an incredibly important resource to continue to provide for consumers. Next slide. So what you see here on the slide is an image of our Get Covered connector. So it's our Find Local Help tool. Consumers can use this tool for free. They enter their zip code. They can search, within what distance they want help to find help, what language it is that they need help in, and then they search for help, and they can find, different organizations in their area that are providing that assistance. Next slide. So the Get Covered connector, again, from a consumer-facing perspective, is free for individuals to use. From an organization perspective, it's free in the sense where you can take this tool and embed it on your website and make it available for consumers to use. If you want to use it kind of as a back-end, scheduling tool, you can do that. It does cost a little bit of money, but you can manage assistor schedules in one system, make appointments publicly available for consumers to book. You can automatically send consumers appointment reminders. We found that the more interactions consumers have with the organization before an in-person assistance appointment, the more likely they are to show up. And then you can, of course, access all appointment data for your reporting needs. And that is aligned with the CMS reporting requirements. So with that, we can go to the next slide. Just thank you so much for inviting me to speak today. And again, I'm happy to answer any questions that you may have at the end of today's presentation. And I'll turn it over to Rochelle.
Well, thank you, Sophie, for your insight on messaging and all of the resources from Enroll America available to help increase access to comprehensive health care. And our next speaker today is going to be Rochelle Brill, and she will be speaking about building strong networks for healthcare enrollment. And Rochelle is a policy analyst at Community Catalyst. Rochelle?
Hi, everyone. Thanks so much for having me. I'm going to be speaking today about strategies for building and maintaining a strong network when conducting outreach and enrollment for Medicaid and CHIP. But first, I'm going to back up a little bit and just talk about who Community Catalyst is. Next slide. So Community Catalyst is a national nonprofit healthcare advocacy organization. We've been around since 1998, and we're based in Boston. And our mission is to ensure that everyone has access to high-quality, affordable healthcare. We think this mission is best achieved if and when consumers have a strong, organized voice in the healthcare policy decision-making process. And so we seek to bring that voice to the table by both supporting pro-consumer policy changes at the national level, while also working with state-based consumer health advocates in about 40 states to build tailored healthcare advocacy campaigns in their state or region. Next slide. So over the past few years, our network of both consumer health advocates and enrollment assisters have developed some best practices when it comes to building a strong network to reach the uninsured and enrolling them in either the Marketplace, Medicaid, or CHIP. One is working with local community-based partners who might have pre-established relationships with the eligible and uninsured. Another is meeting consumers where they are, as Erin mentioned, rather than having your own event and asking consumers to come to you, going out into the community to reach the eligible and uninsured where they already are or are likely to be. And then lastly, training the trainer, or working with community-based partners who perhaps are more likely to come into contact with the uninsured to educate them about health coverage options so that they in turn can educate eligible and uninsured consumers. And I'm just going to give some examples of work that our state-based partners have been doing in employing these strategies. Next slide. So our partners at the Arizona Children's Action Alliance really excelled at both working with local and community-based partners, as well as meeting consumers where they are, by working with school officials to conduct school-based outreach at back-to-school and other school events in the city of Phoenix. So they not only brought enrollment assisters to the events so that parents and children could enroll in coverage during the event, but they also created materials such as the application checklist on your screen that shows all of the documentation needed to complete a Medicaid or CHIP application. And they put that checklist into backpacks and other promotional materials that were already being distributed at the event. They realized that this method was really effective in reaching the eligible and uninsured with both healthcare coverage information and enrollment opportunities, because as Erin mentioned earlier, rather than giving parents an additional item or event to go to or to put on their to-do list, they decided it was more effective to incorporate healthcare coverage information and enrollment into the preparation parents were already doing for their children to get them ready for school. Next slide. Also, our partners at the Children's Defense Fund in Ohio really excelled at working with local community-based partners, as well as training the trainer by using bilingual community outreach workers to reach the eligible and uninsured racial and ethnic minority children in different cities throughout Ohio. And so they used community health workers to not only assess the particular outreach needs of different regions, but then also to meet consumers where they are in the community by conducting outreach and education at existing social service programs, such as at English speakers of other languages classes. Next slide. Another community network that I wanted to mention, and this is a national community network specifically for enrollment assisters, is In the Loop, which is the project that I work on at Community Catalyst. In the Loop is a joint project of Community Catalyst and the National Health Law Program that began in 2013. And the one-sentence description I like to give is that it's a password-protected online community created for enrollment assisters, such as navigators and certified application counselors, to share their enrollment experiences, ask questions to one another, and to also trade best practices and report problems that they're having with enrollment. Right now, we have about 4,700 members in all of 50 states, and it's really a great community for sharing best practices and asking questions. And we often get a lot of questions related specifically to Medicaid and CHIP eligibility and enrollment. Next slide. Another important feature of In the Loop that I like to mention is that it really serves as a feedback loop between assisters on the ground who are conducting outreach and enrollment and federal policymakers. So a really great advantage of having a community of assisters from all over the country is that we're able to spot trending issues that are occurring either between multiple assisters in the same state or different assisters in different states. So one of the things In the Loop does is summarize the issues that we're seeing into reports and sharing them with federal officials at the White House, the Department of Health and Human Services, and the IRS so that they can get a sense of how enrollment is working on the ground. And so In the Loop really serves as a great feedback loop, not only between assisters, but also between enrollment assisters on the ground and federal policymakers. So if you're an assister or you're working for an organization that's a navigator grantee or is partnering with another assister organization, feel free to log on to www.enrollmentloop.org and register for In the Loop and connect with others who are doing the same thing. Next slide. And that's all for me, so I will turn it back over to you, Gabriella.
Thank you, Rochelle. That was, thank you for sharing the best practices and some helpful state examples from all of those people doing work on the ground, to build these strong networks within the community. Our last speaker today is going to be Emily Brostick, and Emily is going to speak about leveraging Marketplace Open Enrollment to highlight Medicaid and CHIP. And Emily is the Executive Director at Consumers for Affordable Healthcare Foundation. Emily?
Great, thanks so much. I'm so excited to be here this afternoon. And so I'm going to be talking just briefly about how we've been able to use open enrollment to get more kids and families enrolled in Medicaid and CHIP. So next slide, please. So first, just some information on my organization so you know where we're coming from. Consumers for Affordable Health Care is based in Maine, and our mission is to make sure that everybody in Maine can get quality, affordable health care. Next slide. We do this in two ways. We help individuals access coverage and care through our Consumer Assistance Program and our statewide helpline, and we also do policy research and advocacy. We are based in Augusta, our state's capital, but we cover the whole state, and we've been very involved with outreach and enrollment in the marketplace ever since it opened, and even before. And we've also been helping people apply for MaineCare, our state's Medicaid program, for over a decade. So we have a lot of experience in this work. Next slide. As other speakers have mentioned today, we have also found that people are thinking about health coverage during open enrollment. Our helpline gets very busy, people calling and just saying, I think I need to do something. I think I'm supposed to sign up for Obamacare. What should I do? And so we found that this is a great opportunity to tell people about all of their different options. Next slide. And we also have the benefit in Maine that we have had a great deal of success enrolling people in the marketplace for private health insurance coverage. And actually, we are one of the top states for enrolling people in the federally facilitated marketplace on healthcare.gov. We're just behind Florida. And well over half of Mainers eligible for the marketplace have been enrolled. So as we have been thinking about how we can get more families enrolled in Medicaid and CHIP, we know we can build on that success and use a lot of those same strategies. Next slide. So lots of different groups are working on marketplace outreach and enrollment in Maine. And so on this group, you see some of the assisters that we've talked about, other presenters have talked about today. But we also have insurance agents and brokers. You have insurance companies who are out there running ads and going to events often, talking to people about their options. Providers and health systems have a vested interest in getting people covered. Enroll 207 is a public education campaign that's run here in Maine by the Maine Health Access Foundation. So we have lots of different groups that are talking about coverage during open enrollment, but many of them are focused on the marketplace. They're focused on private coverage, specifically when you look at insurance agents and brokers, but also some of the other groups. Next slide, please. And we know that, when you talk to people today, we might get a call on our helpline, and that person calling might be eligible for the marketplace, but they're going to have family members and friends who might be eligible for other options. So I think, we saw that most people on this webinar today do both Marketplace and Medicaid enrollments often year-round, and I'm sure you've seen this. People come in thinking they're going to get a private insurance plan, but it turns out, they're eligible for Medicaid instead, and we need to be prepared to help them do that. And for those doing enrollments in our state who are not prepared, we need to help them know where to send those folks. Next slide, please. So just a couple of quick tips from our experience is just to make sure you know everybody who's doing enrollment in your area. So you may already know the navigators and certified application counselors who are near you, but make sure you know the agents and brokers as well. Next slide. And that localhelp.healthcare.gov link that Lisa mentioned at the top of the webinar is a great way to find out who's doing this work that you can connect with. Next slide. And here's a big tip. Once you find people who are doing this work, if you can, offer them training and support on Medicaid and CHIP. So we find that even for navigators and some other enrollment assisters, they just don't know as much about Medicaid. If they're relying on the training that's available through CMS, there's a lot of training on the Marketplace, but the training on Medicaid is not specific to the rules in each individual state, and it's a complicated program. And so we found that people really need that kind of support. If we can help all these people who are out there talking about coverage, learn the basics, they can better assist and refer family members when they meet people who aren't eligible for the Marketplace but are instead eligible for Medicaid. So at CAKE, some of the things that we do is we offer full-day workshops, we do custom presentations whenever we're asked, and we also have some great resources that I'll highlight for you. Next slide, please. So we have a comprehensive eligibility guide that basically goes through the rules for main care and who's eligible under other categories and how income is counted, all sorts of things like that. Next slide. We've also created some great references and resources that navigators and sisters and others can have on hand to use when they're talking to people. And those resources typically, like this example on the slide here, it includes both main care and the Marketplace. So someone can quickly see, okay, how big is the family, what's the income, and quickly scan and see what coverage program that individual is likely to qualify for. Next slide, please. Our next tip is to make sure that you're reaching out to others who are doing enrollment to coordinate. So if you have some great outreach materials with information about Medicaid or about CHIP, reach out to other groups that are already doing events and offer them to them. They would probably be happy to have materials that they could hand out to families they meet who might not be eligible for the Marketplace. And if you can, find ways to collaborate on the events themselves. Offer to have them come and table with you at an event, do presentations together, and just strengthen those relationships. Next slide. And my final tip is to make sure that you have really strong referral relationships with all these different groups. So make sure that all of these different individuals who are working on Marketplace enrollment know that you're available to help with Medicaid, and because this is going to make their jobs easier. If I'm an insurance agent, I'm probably not really going to be that familiar with Medicaid, and I probably don't really have the time to learn it and, help a family navigate it. So we found on our helpline, if busy assisters know that they can send someone to us for help going through an application and getting through the process, if insurance agents know they can send somebody to us, then that's a helpful resource for them that they come to rely on. Next slide, please. So this final slide just shows all the different groups that we have a relationship with, and we found that these relationships really inform everything we do. So we often, like Rochelle said for Community Catalyst, we'll hear about trends that are happening, problems with enrollment that we can then communicate to Maine's Department of Health and Human Services, to try to find a fix to, like a confusing question on an application, for example. At the same time, we might hear something from, DHHS that we could send back out into the field so that people who are helping with those applications know, the right fax number to use when they're sending a consent form, for example. So we use all these relationships to really understand what is happening and how we can best help people. And next slide, please. And that is it for me. Feel free to reach out, anybody who'd like to see links to any of the examples of the resources I shared. Thank you.
And thank you, Emily, for sharing those important tips on leveraging Marketplace Open Enrollment and sharing your state success in outreach and enrollment. That was wonderful. And thank you all for being on the webinar today. We're going to quickly run through some of the Connecting Kids to Coverage national campaign resources. Unfortunately, because of the timing, we won't have time to address questions directly on the webinar, but we have been taking your questions throughout the webinar, and we'll reach out to the appropriate speakers to address your questions and get those answers to you. So thank you. The Connecting the Kids to Coverage coverage campaign has a variety of resources available. So the campaign has a number of downloadable resources to help enhance your outreach and enrollment work. These include tip sheets, e-newsletter and ready-made article templates, PSA radio scripts, and more. In addition to those downloadable materials, there are also digital media tools. So while you're reviewing in the Outreach Tool Library, feel free to use these digital media tools for your social media channels. We also have content and graphics that you can share and e-newsletters that you can share with your network. And some examples of our material topics include year-round enrollment, oral health, vision, teens, and sports. And all those materials are available for download on www.insuredkidsnow.gov. You can also customize most of our materials to support your outreach efforts, and we provide materials both in English and Spanish for all of our materials, and also in a number of other languages as well. The process to customize materials takes about approximately 2 weeks. And all of our outreach videos and previous webinars are also available in the Outreach Tool Library on the Ensure Kids Now website. The outreach videos are short videos showcasing a variety of outreach and enrollment practices from groups across the country. There are several ways you can stay up to date with the latest from Medicaid and CHIP outreach strategies and stay connected to the Connecting Kids to Coverage campaign. To expand your research, connect with the campaign on social media. You can follow IKN.gov on Twitter for campaign updates and share resources across your social media channels. Don't forget to share or tag messages using the hashtags Enroll365, Kids Enroll, Medicaid and CHIP. We would love to see what you are all doing in your communities. You can also sign up to receive our campaign e-newsletters. They are distributed throughout the year and provide updates on campaign activities. If you have any questions or just want to share an outreach or enrollment strategy, please feel free to email our team at connectingkids@cms.hhs.gov. And again, thank you so much. We were monitoring questions throughout the webinar, and we will address those questions with you all individually. I just wanted to send everyone, our speakers and everyone participating today on the webinar, a big thank you. Remember, there are campaign resources available for download on the website, and a recording of this webinar will be available on the website in about 2 weeks. And if you've missed any past webinars, please check out our webinar archive on insurekidsnow.gov. Thank you very much, everyone, and have a great rest of your afternoon.